Good afternoon. My name is Rahma Mohamed. I am a social worker with Virtual Care, Care with a K, and we are here to bring the third edition in discussing Medicaid. So we discussed the application process for part one, we discussed financial review for part two, and now we are discussing the assessment portion. So once you have worked with your, uh, healthcare team, doctors, your doctor, physician, the facility you're in, loved ones, and you know what is the right service you're looking for, whether it is a nursing home, adult family home, or having a Medicaid caregiver, an independent provider come into your home to assist you. Once you have figured out which service suits you best, DSHS, the Department of Health and Social Services, or the state department in whichever state you reside, will be sending a case manager to do a full assessment. These assessments can range from 26 pages to 54 pages. It will go through medical history. It will go through diagnosis. It will go through medications you're on. It will talk about, whether you have any incontinent issues, whether you need any mental health services. It will talk about how independent you are in ambulatory. If you are in a wheelchair, it will talk about how, independent you are navigating the wheelchair. So the case manager will get as much clinical documents from your providers, and she will also be interviewing families. She will also be interviewing you. Most of the time, it's it could be 2 to 3 hour assessment in one day, but they may reach out to you to get more questions. So usually, once you have passed the financial review and you have been approved for Medicaid, you should have this assessment within 1 to 3 months. Ideally, after 1 month is usually when they do come out to complete these assessments. Right now, they can even do it through Zoom, so that has been really helpful with everything that's been going on. So once they come out or you do a Zoom assessment, they'll ask you your background, they'll ask you what goals you have, they'll ask you what kind of services you need. And once the assessment is completed, whether you're going to go to a skilled nursing facility, an adult family home, assisted living, or get a caregiver at home, you would use this assessment, and with the help of the case manager that completed it for you, will be sending this assessment to different facilities, as well as you will be sending it to different agencies to see who can cover your hours or who will admit you into the facility. Now, some factors that may take longer for you to get a caregiver or or you get admitted into a facility is, one, the daily rate that you will get from the state, which is how much the state is going to pay the facility per day of assisting you, as well as if you are looking for a caregiver, the state will send it to Medicaid contracted home cares, and depending on your hours, these home care agencies will see if they can find you a caregiver. So unfortunately, healthcare does have a shortage of caregivers, and they do have a shortage of facilities. So the search can take longer. I would always say, while you're waiting for the assessment, just start giving agencies a call and facilities a call to see which ones have open rooms or which ones have caregivers available. That way you can kind of have something lined up for once you get the assessment. So when you have a daily rate, it could range from $80-something a day to, $200-something based depending on your level of care needs. You would go to a facility, they would ask you for the assessment, they'd ask the daily rate, You may get into a shared room, you may get into a private room. I would always encourage all families and potential residents to tour the homes, as well as interview providers to see who's going to be the best fit for you. Also, when it comes to caregivers, when you are with an agency, you want an agency that is consistent. You want an agency that's reliable. You want to be able to get a caregiver that can, manage all of your needs. So whether if you need the transportation, maybe, find a caregiver that's able to drive you to appointments. If you need, more caregiving hours than were approved, reach out to the case manager again to ask for more. So what happens is if you are getting a caregiver at home, you may get 40 hours a month or 60 hours a month, and then you have to divide that by either 30 days or divide it by the days that you need assistance with. And if you at all feel like those hours are not enough, you can reach out to the case manager and ask for a reassessment. If you believe the state assessment was incorrect as well, you can reach out to the state and ask for a reassessment. So when it comes to those things, know that you can get reassessed. Always go through any assessment that is completed for you to see if it does reflect your care needs. And if it doesn't, feel free to contact the case manager. If you have any difficulty finding facilities, you can go onto the state DSHS portal, and it will have adult family homes and assisted livings that provide Medicaid, that do accept Medicaid clientele. And you can just put in your zip code. And once you put in your zip code, all the facilities for Washington State would come up, and just give them a call, find out who has rooms available, make a list of those, perhaps tour them, and once you do have your assessment, give it to those facilities so they can consider you for admission. If you at all need any help or need any support navigating, feel free to reach out to Virtual Care, Care with a K. If you have any therapy needs, if you have any needs for assessments, home care, home health, or even navigating long-term care, please feel free to reach out to Virtual Care with a K. Our email is support@virtualcare.com. We are here to help you, so feel free to use us as a resource. Thank you.